Hello lovely people, my name is Abby and welcome back to my channel. My hair is really curly because I tried to make it curly last night and it kind of worked, but I don't know whether I might put it in a ponytail just because it's like a little bit crazy. Excuse me if I keep readjusting the camera, it's not very steady. So, okay, so hi. Like I said, my name is Abby. Today's video is going to be a Q&A kind of information video about placement. So I am a first year student nurse. I take children's nursing, so paediatrics. I finished my first placement last week and lots of people have asked questions about it, so I thought I'd kind of let you know what it's like. I think this would have been really helpful actually, to have something like this when I was applying for uni, because you kind of don't get any prep as to what it's going to be like. So yeah, I hope this answers some questions and it's helpful for some of you. And if you have any other questions, leave them in the comments. First question is, did you get to choose your placement? The answer to that is no. I think it's the same at all unis. You don't get to choose where you go on placement. You kind of get to choose. So for example, for me, I knew that my placements would be in the child field because I'm doing children's nursing. Adult field, mental health and learning disability are the other fields of nursing. So if you take one of those, your placement is going to be in one of those areas, but you don't get to choose exactly where you go. So you don't get to choose what ward you're on or what kind of specialism you're looking at first and that kind of thing. Mainly just because there's so many students, they can't let everyone choose. It's just too much for them to do, to let everyone choose exactly where they want to go. Each university is kind of associated with different hospitals and trusts and stuff. But yeah, no, you don't really get to choose where you go on placement. What kind of placements can you have? So I guess I'll talk about child field because that's what I know the most about, but so you can have ward placement, so that's either an acute children's ward, so like a normal ward, oncology, cardiology, depending on where you are, like whether they have specialisms in different ologies, I guess. And then you can have neonatal ICU, paediatric ICU, critical care, surgery. Then in the community there's midwives, so health visiting, community nursing, GP surgeries, school nursing. So when it comes to mental health nursing, you have dementia, older people's, adult intensive, adult community, children's. I don't know if you do children's placements with mental health, I'm not really sure. Obviously on the adult wards there's all the different wards that you'd have in a hospital, like I guess you can guess you could be on any ward, or in the community again. So yeah, you could literally be anywhere, but that kind of makes it interesting because you often don't really know what you want to do like with your degree once you finish. Like obviously if you're doing a nursing degree you probably want to be a nurse, but you might not know where exactly or what kind of specialism you want to go into. So it gives you lots of kind of opportunities to explore what kind of options there are for you out there in the world. I have to keep readjusting this. Sorry about that. Sorry, that's annoying, isn't it? So the next question is, when did you find out where you were going to be on placement? So the first placement we didn't actually find out until about a month before, because obviously it's a new intake, so they haven't got they don't know who's going to be here and what's going on. For our next placement, we've actually just found out our placement area, so either the community trust or the hospital that we're going to be in, but we don't know which ward we're on yet, and our next placement is in 3 months time. So usually you find out the ward 4 to 8 weeks before, which gives you time to prepare for travel and childcare if you've got kids and things like that. So my placement that I just finished was on a paediatric ward, so it was a general ward, about roughly 30 beds, and an assessment unit, which is kind of a bit like A&E for children, but it's kind of referrals taken from A&E or from the GP or from midwives, and we kind of triage them and then decide whether or not they can go home or whether they need to be admitted to the ward. So on this kind of ward we see things like chest infections like bronchiolitis, appendicitis, tonsillitis, all the itises. We see safeguarding issues, surgeries, different MRI, kind of different scans, meningitis, broken legs, broken arms, D&V, diarrhea and vomiting. In fact, on that note, I am going to talk about emetophobia, maybe a little bit in this video, but also I'm going to do a whole video on it because I know that that was a massive deal for me when I started my degree, and I think for a lot of people it's like a massive situation, so I will talk about that. Yeah, that's all I can think of right now, but there's loads of stuff that we saw. What was the introduction like to the ward? So we're meant to get a ward kind of orientation kind of thing, except when I started it was so busy, like ridiculous busy. They were run off their feet and we didn't actually get our induction, which was a shame because it made it more difficult to settle in because we didn't really know where things were. We didn't know what was what, who was who kind of thing. But I get why they couldn't do it, and I know it was so busy, and like we kind of just had to deal with that, which was kind of difficult, but it was fine. Everyone was really lovely actually. Everyone, all the nurses on my ward were lovely people, and most of them were really accepting and really supportive of us and kind of let us do things and showed us how to do things, which was really nice because it felt like kind of you weren't in the way. Like at the beginning it did feel a bit like, oh my god, I'm like in the way, but I don't know if that was my brain being mean because hashtag mental illness. Oh, that's another thing actually, we do get mental health admissions on the ward. We didn't really have many when I was there, but they do have that. How did you settle in? I think I settled in okay. It was really nice because we had the other students with us, and also we had some second and third year students who were also on the ward, so that was quite nice because they could kind of help us out a bit and just kind of be like, it's okay, like, it's okay. But I definitely felt like after the first couple of weeks, so we had 2 weeks before Christmas and then we had 6 weeks after Christmas. First couple of weeks, when I left, I thought, do you know what, I know what I'm doing, kind of. Or at least I'm comfortable in the bits that I can do, and I kind of know when I need to ask for help and stuff. So that was really nice. And by the end of my placement, I felt really confident. Well, I say really confident. Like I felt like I knew what I was doing, for the most part, and I felt like I could confidently answer questions that people asked me, and I felt like I knew what to do and I knew what to look out for, and that was really like rewarding because I felt like, oh my god, I actually know something. Is that my Winnie the Pooh mug? I've had this since I was like a baby, like a toddler. How much support do you get from the hospital and from university? Basically what you have is, at university you have a personal advisor, so that's your contact person in uni who, if you have a problem, you can go to, and it's an academic problem or a personal or a mental health or anything like that, you can kind of contact them and they can either point you in the right direction or you can talk to them and stuff. I haven't actually accessed mine because I didn't want to, but I know people who have, and they've been really, really supportive, which is really nice. Like on placement, we then get assigned a mentor who is the nurse that we work with most, and they sign off our kind of paperwork and stuff. I was so lucky with my mentor. He was just the loveliest guy, and I really got on with him, and he really pushed me to learn and pushed me to do things that he knew I could do, but I was a bit like, but he was like, no, you do know the answer and you can do it, and so that was really nice. And I would have felt really comfortable going to him if I'd had a problem. And then also on placement we have the practice development nurse who is kind of in charge of the students, and she was the loveliest person, and she made us feel really comfortable and was really supportive and was like, my office is always open if you need anything, and you know, it felt really warm, which was really nice. And I think I was quite lucky with my ward that I was on. It was a really like tight-knit community almost, and so I felt like supported, and also all the other nurses, the students, sorry, that were there, we all kind of helped each other out, so that was quite good. It says, what on earth do you do for 12.5 hours? So our shifts are the same as normal nursing shifts, so we work 12.5 hour shifts, 3 days a week. Well, when you're a student, you kind of work 3 days one week, 2 days the next week, 3 days one week, 2 days next week. You'd be surprised. You don't really sit down at all. Busy days, you'll be on your feet constantly. You're doing observations, you're talking to patients, you're sorting out paperwork, you're writing notes, you're going on ward round with the doctors, you're in an MDT meeting, it's a multidisciplinary team meeting, you're discussing outcomes with a different nurse, you're going down to pharmacy to pick something up, you're going to the medical library to get patient notes, you're doing an admission, you're doing a discharge, you're always busy. And we have 2 half-hour breaks and 1 20-minute break. So you're kind of almost like waiting for the next break. But I do have to say, the days go a lot quicker than you'd expect. Kind of like, you get there, the shift starts at 7:30 on my ward, and we finish at 8 at night. So get there at 7:15 for handover, write your handover down, do all your initial observations, write down on your handover sheet when everyone needs their meds, when people need observations, when people need, whether people need bloods done, or urine samples, or stool samples, or I don't know, glucose tests, or that kind of thing. And by the time you've done that, it's like 9 o'clock. First break usually goes at around 9:30. You've got your obs again, and then you're doing something, and ward round is around 11, 12. And you'd be surprised, the day goes quite quickly, actually. And then when it's not a busy day, so quite often the weekends aren't as busy because they don't have elective surgeries or planned surgeries on weekends usually. It gives you a bit of time to, I like to read through patient notes that I've got and learn about paperwork and make sure I know kind of what paperwork goes with what, and read about safeguarding issues and read about different conditions that I've not heard of. I don't know, like there's stuff to do, and then if there isn't for like a few minutes, we usually have biscuits. And we usually just have a biscuit like by the desk. The phone's always ringing, so that's one thing I struggled with actually, is answering the phone. That was really difficult for me at first, and I still don't like doing it, but I've become a lot more confident in being like, it's like, hello, and then I have to say the name of the ward, student nurse speaking, how can I help you? And then if they need to know something about something on the ward that I know, I can tell them, and if they need to talk to a doctor, I can give the phone to a doctor. Yeah, so there's always things to be doing. The next question is, do you shadow people or do you actually get to do stuff? A mixture of both. So I shadow doctors, I went into theatre with a patient, I went to MRI. You get to actually do a lot of stuff. You wouldn't think it. So obviously you've got your observations and stuff, so your blood pressure, temperature, respirations, heart rate, oxygen saturation, capillary refill, like that you get to do straight away. Some of us got taught tube feeding, some of us got to place nasogastric tubes in babies who were struggling with feeding. I helped with quite a lot of bloods, testing urine samples, sending things to the lab, having conversations with patients and their parents. It doesn't sound very interesting when I say it like this, but there was just so many things that we could be doing. I helped with a lumbar puncture, which is what they do to babies. Well, they do it, it's like when you have an epidural and they put a needle in between your spine, like in between your vertebrae. So that was really cool to watch. Yeah, lots of baby hugs, you know how it is. got to cuddle babies, got to feed them. Just kind of being that safe person for a child, which is really nice and really rewarding. Did admissions, did paperwork, which doesn't sound fun, but like it feels cool because I'm like, I'm a nurse. Walk around with a stethoscope around my neck, I'm like, yeah. That's just my first placement, so as you progress through the years and through placements, you'll get to do more stuff, and become really confident in what you can do, which is really nice. And if the nurses are assisting us, we can draw up medications, yeah, like draw up drip lines, and like, I don't know, it just felt like a nurse, which was really nice, because you almost kind of, you do all this theory and you're like, okay, right, okay, whatever. And then when you can go into placement and you can see it in practice and you can like relate what you learn in theory to something that you're seeing in practice, it's really like nice. The best and worst parts of shift work, that if you're working 3 days, you get 4 days off, which is really nice. It almost doesn't feel like you get 4 days off because you're kind of exhausted. It's easier to make relationships with patients if you're there for the whole like 12.5 hours, and also you form quite quick relationships, teamwork, bonds with the other nurses on the ward because you're working with them for an extended period of time. So even if you've only been on 2 shifts, you've been working with them for 25 hours. Like, that's a long time. The worst part, I'm not gonna lie, is exhausting. It's really tiring. The first few shifts I had a proper headache, but I think that's because I had my hair in a bun. I had my hair in a bun for so long, it was like 15 hours by the time I got home, that my hair had been in a bun, and that was like, people have said, how do you cope with getting up early, getting home late, and your meals and stuff? So getting up early, surprisingly, so I got up at around 5:30 for my shifts, and I found it easier to get up at 5:30 than I do at like 8:30 for like a 9 o'clock lecture. But it was long because I got up at 5:30 and then I had an hour drive to the hospital. I'd work my 12.5 hour shift, then I'd have an hour drive back. And so by that point, you've been up, or you've been like on your feet for like a good like 15 hours. And that's really tiring. It was difficult. I have to say, driving back, at some points I thought, do you know what, I should pull over because I'm so exhausted. My eyes are just like closing when I'm driving, and that's dangerous. But you know, I just open my window or blare my music really loud and be like, no, wake up, or like ring Rosie through my car, and just chat to her because I didn't want to fall asleep while I was driving because that would have been dangerous. Fixes I can put it into covered pieces. Who knows what's underneath it? I can. How did I cope with meals? Food was difficult, but not as difficult as I thought it was going to be. If you are subscribed to my channel, you'll know I have an eating disorder. I'm in recovery from an eating disorder, and I'm in quite a good place at the moment. But it was difficult getting up so early, and I have to eat. Like, I ate before I came on shift, so I ate before I left. So I ate at like half 5, 5:45 in the morning, and then we had a break at kind of like 9:30, which was like breakfast break. But I'd already had breakfast. So that was quite difficult because I was hungry, but I didn't want to have breakfast again because I'd already had breakfast. So I would eat stuff. I ate at every break, and then like lunch break was kind of anywhere from 12 till 4, depending on how busy we were. So that was quite difficult because I would start getting like really hungry, and then I'd kind of be past hunger. And I don't know if people who have experienced eating disorders might know this, but when you get past a certain point of hunger, it kind of fuels your eating disorder. It's like, that feeling is like quite addictive. And it was kind of a case of pushing through that and being like, no, I am caring for other people, I need to eat, and I need to make sure I'm in a good place in my head to be able to look after children, really. So I did have like good lunches, and I usually made food like at home and then brought it with me, so that was quite good because I already had it there. I didn't have to buy it because I quite struggle with buying food. And then dinner break would be kind of 6, and if you've had your lunch at 4, eating at 6 again is a bit like, what? But had to be done. So some of my shifts finished at 8, and I would quite often eat a proper dinner when I got home. So I'd have a snack at my dinner break at work, and then I'd eat proper dinner when I got home. Some of my shifts finished at 9:30, so I'd obviously have to eat there because I don't get home till 10:30. I don't really know what I'm saying. It was difficult, but I did it because, well, you're caring for children. You have like their health kind of not just on you, but you're a part of that. You're a part of looking after them, and you're also going to be driving home being tired, and being hungry is not a good idea. So yeah, I kind of almost rationalise it like that, like even if I'm not doing it for me, I'm doing it for everyone else. And that helps me because, like, that's always helped me. Like, I've always been like, if I'm not doing it for myself, I'm doing it for my mum. You know what I mean? Last question is, do you enjoy it? As you can probably tell, yes, I really enjoyed it. Some shifts were hard, I have to admit. Like, it was really hard leaving and not knowing what happened to a patient, or not finding out the outcome, or not knowing how they were. Especially on my last shift, I had a really, I spent the whole day with a little boy, and he was quite poorly, and I'm never going to find out kind of the outcome of that and how he is, and that's really difficult for me. It's really hard not knowing kind of that he's okay. Yeah, that was quite difficult for me. But it was really enjoyable, and it was really rewarding when you got to watch a child leave the ward smiling and feeling better, and know that you kind of were some sort of a part of that. Although I was excited to come back to uni because it's nice to be in my room and just like just have a breather. I'm gonna miss it, and I'm gonna miss the people there, and it's a shame I'll never know kind of what happened to some of these children, but you've got to learn to live with that. Like, that's part of the job and of the course itself. So yeah, I guess that's it. So I hope you enjoyed this video. I hope it was helpful. I'm sorry it's been a long time coming. I did film it before, but I wasn't really happy with it, and so I filmed it again. And yeah, I guess I will see you very soon. If you have any other questions or any requests for other videos, please let me know in the comments. I hope you're doing alright. If you're not, I hope that you know that you will soon, I'm sure. I love you lots, and I will see you in my next one. Let's cheers with the tea.